Happy Friday, everybody. Hope you're doing well out there, enjoying a little bit of sunshine. I am Dr. Palmer. I am coming on this afternoon to talk with Dr. Amanda Adkins, who I can see is just joining us. Oh, thank you so much for being here. Thank you for being available. I've been really excited to dig in and talk to you about today's subject. Hi, Marcy. Marcy's joining us. So just super quick, I'm Dr. Palmer with Pure Pediatrics. We're talking today with Dr. Amanda Adkins, who has a lot of experience with plant-based diets and coaching people who are on plant-based diets to maximize their nutrition. And I'm going to stop there and just let you introduce yourself because I think you'll do a much better job.
Thank you so much. Yes, I am Dr. Amanda Adkins. I am a lifestyle medicine and internal medicine physician, also a health coach. And our focus is to help women who have chronic illnesses like high blood pressure and diabetes get off their medication safely. And then, as you know, emphasize plant-based eating.
I'm really excited to hear about this. Of course, I'm a general pediatrician, but I do have a couple grown-ups that come into my life in the way of mothers, and in particular that I work with. But I thought we should just start with like some definitions because I'll tell you, like I'm not a plant-based diet eater. I do try to eat more plants than animals, but in my head, I kind of just think is being vegan and being plant-based the same thing?
No, no, it's not. So,
Okay.
easy terms, people at this point in time use them interchangeable, but I like to always point out the differences. So,
Yes.
the biggest difference is that vegans, they have a bit deeper, I would say, calling calling their life, where they may also extend that not just to their eating patterns, but also to their life. So they will also not have any type of animal products in their like skincare, in their clothing, and things of the such.
Okay.
So nothing. If something's been used an animal product, or animals are being cruel, a part of that, then they don't use it. But as far as the actual eating pattern, a lot of vegans may also still eat a lot of processed foods, high sugary foods, candy. I tell people like Skittles and Oreos are vegan, but not necessarily plants. Whereas when we focus on plant-based eating, and as far as the actual health benefits, is the whole food. So a food that you can just walk by and you would recognize. So like an apple, an orange, broccoli, soybeans, things like that. So it's focusing on actually eating the food in its natural form, which is where you get more of the health benefit than if it's like even like plant-based ice cream that they may say it like that. That's not the plant-based that we're really referring to.
Okay. So, well, that is actually a really good clarification. So thank you for that. I was kind of wondering as you were talking, hi there, Lindsay. Thanks for joining. As you were talking, like, what are some of those health benefits? Because, like I said, in my head, I had the two things just kind of like interchangeable, and so that's a really important clarification. But what are some of the health benefits of being a plant-based eater? What do you see in your practice? Why go plant-based?
Start with my story. So my story, initially, I did vegetarianism, then vegan, then plant-based, because I was learning about these things too. So I first was doing it for weight management, weight loss. So if you actually are, a whole food plant-based eater, and actually focus on eating the whole foods, in my experience and my experience of some of my clients, is that the weight kind of naturally comes off if you are an overweight person. Now, if you're already normal weight, then you would not, continue to lose weight and be underweight. But that's one of the biggest health benefits that I see on my personal journey, is the weight loss, and then weight management. Keeping it off is easier. Also, controlling your blood sugar. So there have even been studies that show that you can actually reverse some people that have type 2 diabetes, actually getting your better blood pressure control, heart disease. You can actually manage your heart disease better, or even possibly reverse heart disease, decrease your risk for certain type of cancers, especially like our reproductive cancers, like breast cancer, also help with prostate cancer. It also helps with some joint pains, like people as they get older, they're always achy, and they go to eating plant-based whole foods. They're like, oh my goodness, I didn't realize, how many joint pains I had waking up in the morning. You sleep better. I mean, that was huge for one of my clients. She was like, oh, I can't believe, I'm actually sleeping soundly. I'm sleeping 8 hours and I wake up refreshed. You have more energy. You don't have the brain fog. So a lot of people, as they're going through the day, they're just like, I just can't think anymore. I got to shut it down. Well, that could be due to some of your lifestyle things, the foods that you're choosing to eat. So those were big things. Skin things, I say a lot of people reference that also. So it's like the whole body. You see changes in every part of your body when you do actually plant-based eating.
That is fascinating. I did not know that. And I guess my question is how quickly do you see that happen for people? Is it, I'm going to say probably 90 days is what it takes in most cases to see changes. And, if you start exercising, you're going to maybe see the influence of that about 90 days out. But how long does it take for people who are really kind of following a whole foods plant-based diet to really kind of see some of those changes that you've mentioned?
They're on different spectrums. So I don't want people to think it's 3 months. That is not the case. I was doing a 5-day, what I call detox or cleanse, where people just ate whole plant foods. And in those 5 days, they experienced better sleep. They had less joint pain. They had more energy, better mental clarity. Their blood pressure even came down some.
Wow.
So it does not take a long time. And it also depends on what your previous diet was like. So if you were already right there on the edge, already doing well, then you may not see a significant change like that quickly with some things, but you're definitely going to see the energy, the sleep, and the joint pains, I think, more quickly than anything else. Then as far as the blood pressure and diabetes or blood sugars, that may be a little bit of the longer scope, because it just depends on how much inflammation is already in your body and what else you can see to make those changes. But I have actually yesterday, one of my clients called me and let me know about her. She went to her doctor, and her doctor was like, oh my gosh, your blood pressure is very good. I can't believe this is it. She's like, I'm going to check it again just to make sure that the nurse was right. And it was actually lower when the doctor checked it. And so I had been working with her for over a year, but she saw these changes about the 90-day mark, 12 weeks, a little bit longer than that. So about 12 weeks. And so, but it's continuing on. So it doesn't take long for every single thing. And I love that about plant-based eating, because people get that positive reinforcement so quickly.
That is so awesome. I'm really inspired. I would say I'm plant-based curious, for sure. Maybe I'll try it. One of the things too that came to mind, it sounds like you work with a lot of women, and, women do have some additional maybe nutritional needs more so than men. So women who may be cycling, they need to consume things that are a little richer in iron, and then also paying attention to calcium intake. Is it possible to do that on a plant-based diet? And what do you recommend? Is it something that you're monitoring? Do you have a list of foods that you want your patients to be eating to make sure that they get enough of, the food-based iron sources and calcium sources?
Monitor it directly, especially in the coaching side of it, but I just tell them that they want to look out for. And they would be, eating their lentils, which has a lot of different vitamins. And just to point out, all these foods, they are more almost interchangeable. They have so many different nutrients in them that you can use, one, and it actually helps something else. So it doesn't have to be as complicated as people may think. So I always try to simplify everything for people. So it's okay, you eat this, it's going to have your iron in there. You may have some other vitamins and nutrients in there that's going to help. So lentils is big. Green leafy vegetables are big for iron rich. Tofu, I have people do that. especially on, because they always think about protein too, but those are big. Quinoa, also, I love adding that into like a salad or doing a grain bowl, and you can like put in a lot of other like vegetables in there. Adding in oatmeal, like overnight oats are my favorite for iron. So I have people do that. So it's so many foods, and I usually have like a printout that I tell them also for my patients in my practice, that I'm like, okay, here are, you know, some iron rich foods that you want to eat. Same thing for calcium that you do, because big thing with calcium, you may ask this later, but it doesn't have to necessarily be dairy. And actually in plant foods, we actually absorb the calcium from some of those foods better than we do actually animal-based foods like milk. And actually, when we actually drink dairy in those different countries, that our fracture rates are higher in people that actually drink like cow's milk than the ones that don't. So we may not necessarily think milk does a body good. You know, that was back, I think, in the early 90s or something like that, that you wouldn't have to actually have cow's milk, especially for children. And just in my own experience, I have a 4-year-old daughter now, and as I transitioned her from breast milk, I actually was looking for a plant-based option, and actually talked with a plant-based pediatrician, and she was telling me about soy milk. So soy milk is good with, you know, iron and calcium. And so actually having her drink that, she's done that since she probably was almost 2, which got her, you know, the nutrients that she needed. So you definitely can get all the nutrients that you need on a plant-based diet. And just have to be, you know, curious, like you said, and give different varieties, and so different things like that. So you definitely can get everything you need from a plant-based diet. You're not going to be usually deficient unless you eat, you know, one food all the time.
Right. Oh my goodness. This is such good information. I was noticing we have a couple people joining us out there, and if you have any questions, just post them in the comments. You know, it's I'm happy that you kind of got to this point too of like asking, well, what kind of plant-based milk would be appropriate for my daughter? Because one of the reasons why I wanted to bring you on is because even though I'm a pediatrician, I have several like cohorts in my practice of people who aren't necessarily, you know, drinking cow's milk or eating meat protein. So like I have lots of kids, and actually my son did it too. When he transitioned from breast milk to regular milk, he didn't actually want cow's milk. And that was one of the things that made me think, oh goodness, I have to find other sources of calcium in your diet. And that it's actually okay for kids not to drink cow's milk. However, we do need to find other sources of calcium for your child if that's the case. And so, you know, some of the things that I'll talk to my patients about is, you know, check your tofu, because some tofus are produced with calcium. That would be preferable. The things like almonds, almond milk, almond butter. Almonds are really high in calcium, and so that might be a really good alternative for you. And then, you know, I'm not plant-based, and so like, you know, a non-plant-based suggestion might even be like eating fish with the bones in them, which most of my patients do not take me up on, because that would be anchovies and sardines. And most kids, that's not high on their list. And so then my list kind of gets short, and I'm like, okay, what else can we do? Yeah, I think beans are also high in calcium, but you know, not every kid out there is drinking cow's milk, and it's okay as long as, you know, as parents, as the grown-ups in their lives are paying attention to some of the other sources. And then what, you know, as you mentioned too, eating those green leafy vegetables, lentils, I think, are probably one of the healthiest foods on the planet. You know, and I get to those because I have a lot of teenage girls who may have decided they're going to go vegan, or just, you know, prefer not to eat meat. And then, you know, they come in to see me and they're eating bagels and cream cheese, and they're, you know, lo and behold, they're iron deficient. And so then we kind of do an overhaul of like, what are you eating and how are you eating it? And so I'll usually recommend, you know, I'll say if you're doing lentils or that spinach salad, if you put a citrus vinaigrette on it, citrus vitamin C actually helps you absorb iron a little bit better. You know, and then sometimes, I mean, in some cases, we really are actually having to supplement iron because it's been kind of a pattern of eating that's come along for a ways, and now we're completely iron deficient. And I just, you know, I many times will start young women on iron supplements to just kind of bridge until they're actually consuming enough iron-rich foods in their diet. They're able to hold their own that way. So that's super helpful. So once somebody's gone plant-based, well, in your program, how do you keep people sort of like, do you find that people kind of make that transition pretty easily, that when they come to you, they're ready, or do you find that you kind of have some degree of accountability and just kind of checking in to make sure that they're hitting all of the nutritional recommendations?
Like they check in to make sure, because we kind of fall, we're creatures of habit. We fall back into what we were doing before. And so just a check in to make sure, you're actually accomplishing your goals. So you actually know what you're actually taking in. And like you said, for teenagers, I was a teenage girl, become vegetarian. So you definitely have to be careful with trying to balance what you're eating. And I'm glad you're doing this, because I wish I had this when I was younger, to actually hear these different things. But yeah, I have them check in and see what they're eating, and to make sure they're eating a variety, because that's how you get all the nutrients that you need. And I know we're not talking about this, but I always like to make sure people know that there's two vitamins that you would not get on a plant-based diet, and that's vitamin B12, which is very important for the nervous system, and vitamin D. So those would be two things that you would have to supplement. I know that's a little bit off topic, but I always like to push that in so people don't feel like they're getting everything just in the plant. So those would be the only two. But I would definitely recommend, looking at everything else and eating a different color of the foods also. So you want to make sure you're doing that when you have the different like bell peppers, because that's a good one also, and there are different foods that you may be eating. And then you mentioned lentils. And sometimes when people get plant-based, they're like stunned. They're like, okay, so I'm only going to be able to eat, X, Y, and Z. But there's so many different recipes that you can use for different foods that you may encounter. Like I'm really promoting a lentil meatloaf for Thanksgiving. I had that last year. It was so good. You can do like lentil burgers. You can do lentil tacos. I mean, so whatever food that you actually like, the source of food that you like, you can actually, transition lentils into that food category that you like. So don't think that you're stuck into one way of eating the food. You can do so many different things, just like you do with meat. So I just want to keep that open for plant-based, curious people.
Yeah, no, I think that's an excellent point to make about the vitamin B12, which, if you're not plant-based, you're probably getting that in certain types of meat. But vitamin D, even if you're not plant-based, you're not getting enough in your diet, because there really is just a very limited list of things out there that naturally contain vitamin D. I live in the Pacific Northwest, so I tell my patients, if you're eating salmon, that oil under the skin actually is rich in vitamin D and omega-3 fatty acids. Whole eggs, what else? Oh, if you're drinking milk, there's a little vitamin D in that. But other than that, and then mushrooms are, I think, the only thing in the plant world that naturally has vitamin D in it. So it's really a short list. And most people aren't eating enough of any of that to get enough vitamin D. And especially up here, our days are shorter and they're dark. So everybody needs to be supplementing vitamin D for sure. Yeah, and I've been experimenting recently with lentils, and I think some cultures do a lot more with lentils, so that might be a good way to look for different types of recipes. My new favorite is actually it's a classic Mediterranean lentil soup, and it starts with like red lentils, and I think onions, and it's got cumin in it, and I think it's got, I don't know if it has turmeric in it, and oregano. And it's amazing. It's the same little lentil, but with the combination, it tastes like a completely different type of food. And then you put a little squeeze of lemon in it, so then that potentiates your iron absorption, and that's like the perfect meal. So yeah, I'm definitely like plant-based curious. I know we had a couple people out there, and we had a couple friends join too, like Dr. Sweldo and Dr. Violina Bhattacharya. I don't know if you're still out there, but thanks for joining us. And then some of my patients have popped on. I don't know if some of your patients have popped on, but it's just a really interesting topic. So do you find that it's harder for people around the holidays if they're just transitioning to plant-based? Because I feel like and I would say, like, for me, like, one of my apprehensions is like, so I grew up always baking, so it's a little harder to do that plant-based. It can be done, but also too, just like holidays are full with like sort of cultural and traditional associations with foods. So how do you help people kind of get through holiday situations where they've decided I'm going to do this because it's better for my health, but then there's sort of the rest of the family and all those family traditions?
Personal experience again. This is me. The rest of my extended family is still basically meat eaters. So what my mom has actually done is she looks at the recipes that she has of what we usually eat and see what we could substitute in, because that's going to be the easiest thing. Like that way, it still tastes almost similar. It looks similar. A big one was vegan dressing that I would use.
Mhm.
So she just cut out, the turkey, gravy and things like that. And we found vegan alternatives to put in there. And there's so many websites out there now because it's things and there I would say, you would actually type in like vegan and like mac and cheese or vegan green bean casserole. Even though, we talked about the difference between vegan and plant-based, but that's the easiest way to find it online. And the food still tastes great, like, guys. So I just want people to know that, like, there's especially now, there's so many alternatives that you can use that will still be healthy. They're not going to be high in a lot of fat and sodium like you would if it was the animal-based alternative. And I'm actually trying to put together different websites that actually have these culturally conscious holiday recipes. So that way it's put together for people already. So we're working with that now so people can just find that easily. And it will definitely help you through the holidays. Because like I said, the lentil meatloaf was one that I don't cook that much, but my sister cooked it for me and it was wonderful.
Oh my goodness. I'm interested in getting that recipe from you because I do have some plant-based eaters in my life, which, I think kind of fits in with the plant-based curious. But honestly, like it's been really helpful because, sort of I think when you are plant-based, you end up paying more attention to your nutrition. And I think you end up learning about the different nutritional qualities of the foods that you're eating, and as you prepare them, like what combinations you might do those in. And then, as I've had patients come to see me, I'm like, oh, it's okay if you're not drinking milk. Here's what you can do instead, right? It's okay if he's not eating meat. Here's what you can do instead. And it's really funny because every once in a while I'll have a mom come in and she's like, you know what? He doesn't eat any meat, but he loves vegetables. And I'm like, we can work with this. It's okay. He's going to be fine.
Great.
And yeah. And so I think that like, looking at the world through plant-based eating lenses is actually a really good way. I think, even if people aren't going to go 100% plant-based, but just looking at it through those lenses, I think helps us make better food choices, right? And then kind of turn down some of the things that maybe aren't as healthy for our bodies. So I see we had a couple other people join us. If you have a question, Dr. Bhattacharya said, this is a great conversation. Let's food be our medicine this winter. That's a great way to head into the winter season. Gosh, this is such a fun conversation. I feel like I could talk to you about recipes, over and over again, but definitely please share the lentil meatloaf recipe if you can. That would be awesome. So,
can I mention one thing for you real quick?
Yes.
So you were talking about the 100 going completely plant-based. And I can say that most of my clients, when I talk with them, I tell them, even my patients, like anywhere along the spectrum that you move, you're going to see some benefits of transitioning from like 100% meat eater to 100% plant-based eater. As long as you move closer and closer to that plant-based side, you're going to see some of the benefits. So it's not like it's all or nothing. So I just like to encourage people that way. A lot of my previously meat eaters, they may be more like 80 to 90% plant-based. They may not be 100%, but they still get the benefits for the health changes. So just to encourage someone out there too, that it doesn't have to be 100% plant-based. You can actually just move towards that way.
That's actually a really great suggestion because it doesn't have to be all or nothing, but just kind of get a little closer to, eating more plants in your life. Well, that's very reassuring for me. I had a question as you were talking too. So for plant-based diets, what kinds of snacks would you recommend during the day? Like if somebody, wants a snack, like what are some quick, easy snacks? Because I'm just thinking, I've got moms out there, I've got kids out there, even me. What would you recommend that we tote around that's like filling and healthy and good for our bodies?
where you don't have to refrigerate, it would be nuts and dried fruit. Like that's me and my daughters go to. We love that combination. I love also like carrots and hummus. So those two are big for me. I eat those almost every single day. And that's the easiest thing to carry with you. You can also make your own like energy balls where it's just like nut butter, some dates, and maybe like some plant-based chocolate chips or something like that to make them tasty for your kids, or rolled oats. You can put those together and then take those with you. They're very easy to make. You can make one night and put them in the fridge and then take them with you. But again, it doesn't have to be complicated. You just want to plan ahead of time. And my sister definitely has me as the planner with the snack bag. So we always want to make sure we have that. She makes her own granola too, which is like wonderful. So every time I go with her, I'm just so happy because she has the snacks ready.
I love that. Yeah. Well, and actually that is the truth. Like, even if you're not 100% plant-based, like if you plan your snacks ahead, and I think, a lot of the doctors out there, hi, Dr. Una, she's popped in to say hi. I think a lot of doctors and coaches out there that are trying to help people make healthier food and lifestyle choices would suggest that, like, you plan your meals ahead, right? So even if you're not 100% plant-based, but I like this energy ball things. I actually had a patient that came in the other day, and his mom said, yeah, we make these things called fat balls. And I think there's like nut butters in there, and then there's coconut milk, but it's all, plant-based too. So I love that idea. Well, I'm going to search out there for some energy crackers and recipes and see what we can get out there. Well, it has been so fun to pick your brain about plant-based eating, because like I said, I'm super curious, and I'm always trying to eat more plants in my life. So I definitely appreciate your time. So I have seen you posting stuff out there with gorgeous pictures of plant-based meals out there, and would love for my viewers and all the other viewers out there to be able to find you. How do they find you to work with you and see the beautiful photographs you post?
Dr. Amanda Adkins here on Instagram and on Facebook, so you can follow me there. My website, you can go to dramandamd.com, and you can get actually some plant-based recipes off that site too. And usually, like I said, I'm not the huge cook, but I definitely can put together from what other people have put together, and then share those with you. So you have that just all in one place. So you're like, okay, I just click through here and find all these. So it's wonderful.
Awesome.
Thank you.
Awesome. Well, thank you so much for your time today. So fun talking to you. And I hope that this gives people some ideas out there of how to really kind of boost the nutritional content of what they're eating. Even if like in your head, you're like, I can't go 100% plant-based, here's some great ideas of things that you can involve. And it's been fun. We've had a lot of viewers out there kind of like, putting up comments. Dr. Una said, hi, Dr. Palmer, Dr. Adkins. So here we are. Well, thank you again so much for your time. I really appreciate it. And I hope everybody out there has a great Friday. If you're looking for a general pediatrician in the Portland area, we are accepting new patients at Pure Joy Pediatrics. So come and see us, or bring your plant-based diet questions, because we are ready for them. Take care.
Bye-bye.
Bye.